historically, gastrointestinal cancer is diagnosed in patients, in older adult patients, but recent evidence they mentioned that there is a lot of rising incidence in um, early onset cancer, which is defined as cancer that diagnosed in patient age less than 50. My name is Dr. Port Saigon Dan Panishgun. I'm the first author in the study titled Early Onset Gastrointestinal Cancer and Metabolic Risk Factors Global Trend from the Global Burden of Disease Study 2021, recently published in Mayo Clinic Proceedings. From our understanding, there is no study that evaluates the global trends of early onset gastrointestinal cancers. And at the same time, there is a lot of emerging prevalence and incidence of metabolic risk factors in younger adults, including obesity and diabetes. Given both increasing trends, so we use the data from the Global Burden of Disease Study 2021 to evaluate the trends of early onset gastrointestinal cancer, including the metabolic risk from 2000 to 2021. And in this study, we found that in just 2021 alone, there is nearly 500,000 new cases of early onset GI cancer. And at the same year, there is 285,000 deaths from early onset gastrointestinal cancer worldwide. And with this cancer, that is account for 10% of all GI cancer incidents and 8% of mortality, with a significant growing share of cancer. And among the 6 types of cancer, body tract cancer, liver cancer, pancreatic cancer, colorectal cancer, esophageal cancer, and gastric cancer, we found that early onset colorectal cancer is one of the highest incident and daily, followed by gastric and liver cancer. And we also show that the age standardized incident rate is increasing from colorectal cancer and body tract cancer. Importantly, we also found that the driver risk factor of death and disability is from metabolic risk factors, including diabetes and obesity. So this study have the implication that there is a growing burden of young adults with early onset GI cancer. It raises the important public health question. First, this trend might reflect the growth behavior, dietary pattern, lifestyle risk factor, obesity, alcohol, or maybe antibiotic use. And secondly, screening policy are lagging behind these changes. Only cancer that is implemented in the guideline is colon cancer screening, but they're still limited in many countries. And also, there's a lot of study mentioned that the liver cancer screening, particularly in the steatotic liver disease, is underutilized. And our study is highlighting the urgent need for multidisciplinary prevention strategy, including metabolic risk factor control, lifestyle intervention, and possibly pharmacotherapy targeting obesity and insulin resistance. So in summary, early onset GI cancer are a growing problem health threat with rising incidence and rising mortality linked to metabolic dysfunction. So our finding underscore the need for global public policy response, earlier screening, and greater collaboration between gastroenterology, oncology, endocrinology, and primary care doctor, and also public health policy as well to reverse this trajectory of rising burden of early onset GI cancer. Thank you very much for your attention.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.